can anyone else just not get over the fact that it is mid-November already? I just can't even believe it. We are staring at Thanksgiving. And I just feel like we just started this series. If you've been with us before, we've been doing this series, goodness, since March, April, May. So here we are now in November. Again, any topics, ladies and gentlemen, if you're there who are joining us tonight, any topics that interest you for the future, please let us know. You can drop that in the comments as well. So we are going to go ahead and get started because we have some great content to cover and we're ready to dive right in. So again, thank you for joining us tonight. My name is Cierra Bragan, and I am the owner and founder of Miami Mom Collective. We are Miami's premier parenting resource and community. So we support local moms through resources, events, a number of things in the community, especially providing resources like this. So we're thrilled to partner with UHealth Jackson Children's Care on the series. Like I said, we've had topics, everything from autism to COVID and anxiety to sending your kids back to school. Really a lot of amazing resources. So those of you, a lot of you who are here for the first time, you can go back actually and watch any of those. So they're all available on jacksonevents.org. So go back anytime and check them out there. So, ladies, if any of you are pregnant, you know that sometimes it's just hard to sit and talk without catching your breath. So I'm thankful that that we've got an OB with us today who says, okay, I get that you're very pregnant and sometimes you have to take a breath. But I'm excited to introduce you to Dr. Rachel Franklyn. She is Associate Medical Director at Jackson Medical Group in the Department of Obstetrics and Gynecology. So she is from Atlanta, Georgia, but she earned her medical degree at Miller School of Medicine. So she's very familiar with Miami and the area and certainly the School of Medicine. So she completed her residency and training at Jackson. And she also specializes, this is interesting. So a lot of what we're going to dive into tonight, but she specializes in preconception counseling, low and high risk obstetrical care, as well as women's care, cervical cancer screening, contraception counseling, and gynecologic issues such as abnormal uterine bleeding. So I don't know anything about that, but you know everything about that. So I know you have a lot of great wisdom to share with us. But Dr. Franklyn, thank you so much for being with us tonight. We're so glad you're here.
Thank you so much, Sarah, for that wonderful introduction. I hope you can hear me.
Yes,
okay,
we can hear you good. Can everybody hear? If y'all have problems or trouble, just let us know.
All right. Thank you so much for allowing me to talk on this topic, which I find to be probably one of the most important topics in the field of OBGYN and very much overlooked. You know, when it comes to women's care, I know we're very good about each of us going for our pap smear or even if, you know, every few years just to kind of get a checkup. But more often than not, our first visit with an OBGYN for pregnancy is after we're pregnant. And in fact, we're going to learn talk that the first visit should be well before pregnancy tests. And that's really the goal of this talk, preconception counseling.
Yeah, I'll admit, when I saw that this was the topic, I thought, oh, I kind of thought preconception care was only if you're like struggling to get pregnant. You know, I never thought of it as like, okay, I should start be thinking about these things like proactively before we do get pregnant. Because yeah, I've had a couple pregnancies and that first appointment is when you know you're pregnant. So super interested and excited to learn more about it. Tell us more about what is preconception care and when should we make like a preconception visit? At what point when we're thinking about having another baby or having a first baby?
Sure. So preconception care overall is care that focuses on taking steps at this moment to protect the health of both mom and baby for the future. So essentially it's at your visit, an OBGYN will want to do a few things at that visit. Number one, to identify any risks to the mom, baby, or pregnancy overall. Another goal would be to educate women about the risks that are associated with either their medical issues, their surgeries, their past OB history, and to offer interventions and managements to the patients. And lastly, to initiate these interventions in order to promote overall a very healthy, happy, safe pregnancy. Now, you asked the
Awesome.
question of when should you make your preconception visit? So it sounds like a long time, but there's a lot of reason for this. A preconception visit should be made ideally a year before conceiving. And I know it does sound like a long time, but a reason
Right.
why we say a year is because at this visit, your OBGYN really should say, so, after going through the history, so when do you want to get pregnant? If your answer is in a year, that's the moment to actually capture the relationship between the physician and patient and say, okay, since I have you and you're thinking about pregnancy in a year's time, let's go over all of your medical issues. Let's go over things that could complicate your pregnancy in the future. And if any intervention needs to be done now, we have a year's worth time to intervene. And there are some medical
Sure.
that could require a year. And that's why that's the time interval that we would like to see that preconception visit.
Okay, that's great. I'm thinking, why have I never heard of this? Like, this is great news, because you kind of think sometimes you can feel insecure or nervous to be like, well, I don't need to see him if I'm not pregnant yet. Like, I don't want to be hyper, vigilant or proactive, but like, it's actually a very good thing, because what you said, you may think that, okay, we're trying now this month or whatever, but then you run into a roadblock. So that's really good to remember,
And
to factor in that time for those.
right, but also remember 50% of all pregnancies are unplanned.
Hmm.
So I have a lot of patients who say,
No.
we're trying, we're not really trying, we're not preventing it, but we're not really trying. So a lot of patients, a lot of women forget that 50% of all pregnancies are unplanned. They just happen. So more often than not, women are kind of not prepared yet to become pregnant. And then we have to kind of retroactively go through all the issues. So you're absolutely right. It's a very important and very overlooked subject. So I'm really glad we're addressing it today.
Oh, that's good. So is there, like, I guess, what all is covered in that visit? Like, is there testing particular that is done? I know you said you kind of look for those pre-existing conditions or something you might run into.
Right. So overall, it covers a host of different topics. It's really going to be the mother's age, her medical history, her medical issues, her past surgeries, all of her medications and allergies. It goes over family history, any genetic issues. Very important, past pregnancies or past deliveries, any complications with those. In the field of OBGYN, we definitely have a saying that what happened before can definitely happen again. So sometimes the first pregnancy is pretty much kind of a roll of the dice. We don't know what's going to happen this pregnancy. The second time around, we're better prepared because now we have the knowledge. Okay, this is you. This is what happened to you in your last pregnancy. What can we do better? What can we anticipate? And then lastly, we go over any, like I said, heritable diseases. We go over vaccination status. A lot of things are going to be covered at this visit. It's very lengthy, but every part of it has a reason.
It's so important. That's so good. I remember with one of my pregnancies, maybe my first or second, but it was like 8 or 9 months in. I mean, towards the end, maybe they were doing an ultrasound, and I was like, oh, I failed to mention that my husband has a brother who had a cleft palate. Like, is that something that's hereditary? Could that be? And they were like, oh, yes, like that's something we should have discussed. And thankfully, everything was fine. But it's just you don't think to talk through all of those things. But in something like a preconception visit, you would totally go through all of that. So that's great. Yeah, just something I hadn't even thought of. But okay, what about, I'm about to just deliver a baby here on Monday. So, or sooner, we'll see. But and if I want to become pregnant again in the future, is there a certain amount of time that I should wait?
So, interval between pregnancies is something that a lot of women don't think about, but is very, very important and serious and could have implications on future pregnancies. So, for example, a woman delivers either via vaginal delivery or C-section. Really, the optimum amount of time in between pregnancies is a year to a year and a half. And the reason for that is studies have found that at that interval in between pregnancies, it has increased the welfare of both mom and the current newborn. If a mom is currently breastfeeding her baby, and now all of a sudden, 5 months later, she becomes pregnant again, So now she's giving a lot of her nutrients through her breast milk to her newborn while still trying to pull from her nutrients to grow the growing pregnancy. So you can imagine in a short interval pregnancy, which is considered less than a year, or some would say 6 months at times, definitely a risk of restriction in the next pregnancy. So that's why we usually say, if you're thinking about pregnancy, again, we really, really do recommend waiting a year, ideally a year and a half. And that's in order to optimize a mom's nutrient status for the next pregnancy, to prevent issues of growth in the next pregnancy, and also to prevent any type of negligence with her current newborn. It's difficult if you have a newborn breastfeeding and you also have to take care of a current pregnancy.
Right. Okay. I have a question, deviating a little bit, but on this subject, I myself had a miscarriage this last year, and I know I have friends that have undergone the same just horrible situation. What is there like kind of a suggested amount of time before you try to have another baby, or is there some time you should wait there?
Absolutely. So, after, miscarriage, while it is very unfortunate, it is actually extremely, extremely common. It happens very often. And I think a lot of the reason why women are maybe ashamed of it or very saddened about it is because women don't share these stories with each other. And I wish that's it a little bit more, because then it would be a little bit more of support amongst women to show that this is kind of a natural, spontaneous thing, and that you can absolutely become pregnant again, such as in your case. So let's say a woman has a miscarriage. How long should she wait before getting pregnant again? I mean, it really does depend on the gestational age. For example, if it's a first trimester loss, less than 12 weeks, really once, the periods start again, she starts ovulating, she could be pregnant again just fine. However, you get into those more complicated settings, for example, second trimester losses, 12, 16, 18, 20-week losses, which is always very, very difficult. At that point, I would recommend waiting a little bit more, just because the uterus has grown a little bit more, the mom's nutrient status is a little bit different, and also because it is such an extended pregnancy that ended in a loss, psychologically it might be more beneficial to wait a little bit longer than an early pregnancy loss such as 5 or 6 weeks.
Oh, that's good. Yeah, because the mental health piece is so important too, like you said, just all of it together. So that's great. Okay, circling back, so you said in between pregnancies, like ideally at least a year to year and a half. What about waiting like much longer than that? Is that negative, or really no issue?
So the only thing, obviously, and we'll touch on this later in this talk, waiting a long time when it comes to age, especially, could have implications. So if a mom is getting around a certain age where her fertility might be compromised, at that point, I might say, listen, you might not want to wait 6 years for your next baby, especially if you want to decrease complications. Now, there are, things like a longer interval pregnancy where, let's say, a woman has 2, 3, 4 vaginal deliveries back to back and then waits 10 years, has another happy surprise. That pregnancy won't act like an immediate pregnancy after her last ones, because there's been such a long amount of time. So it might change her labor course, for example. Whereas her fourth delivery delivered in a few minutes, this delivery could have been so long, it might be like her first, and she'll say, why am I here on the labor floor for a day and a half?
Right.
So in that case, yes. But really, the main issue is the shorter interval. The longer interval doesn't have as many implications to it.
Okay, that's great. Thank you. That was a question that we received from our audience. So I wanted to address that. Okay, what about talk to the mom who has been trying to become pregnant for months, but is still going, is there something wrong with me? Like, should I seek an OB? How would you advise that mom?
Right. So, and that's definitely why with the preconception visit, one of the things we talk about is a woman's gynecologic history. We talk about when her period started, how regular are her cycles. It gives us an idea of, does a woman ovulate? Does she ovulate on time? Is there an issue with infertility here? Now, infertility, we know, decrease, or the rates of infertility increase with increasing age. So what I'm talking about is advanced maternal age. Advanced maternal age is, by our studies and all the data that we've collected with older moms, and as we're seeing, our moms are getting older, it's just the natural way of things, is age 35. And while I think that that is very young, I think that's very young, just to put it out.
I'm in the category. I have a geriatric pregnancy right now, I guess.
35 is very young. Unfortunately, our biology has not caught up with the times. And while we are delaying pregnancy a lot more, as women reach higher education, as we have access to contraception and we have better family planning, unfortunately, the eggs that we have inside of us, we had when we were inside our mom's bellies. So they've been with us for a very, very long time. And 35 years old is kind of the age at which our eggs really start to begin to cause problems. Number one, with genetic issues in pregnancies, but also with fertility. So we know that at age 35, fertility goes down. So let's say a woman is 37 years old. She's trying to get pregnant. At what point should she really reach out and make an appointment with an OBGYN? At what point should she say, listen, it's not happening on its own. I really need to seek care. We give that about 6 months. A woman over age 35, if she's trying to get pregnant, actively trying to get pregnant, not just not having contraception and waiting to get pregnant spontaneously. If she is actively trying to get pregnant with her partner and is over age 35, at 6 months, if no spontaneous pregnancy, I recommend to go ahead and make that second visit, because the first visit was the preconception. Make that second visit. And that's another benefit, by the way, of the preconception visit, because then the OB can say, okay, you have these risk factors. One of them is over age 35. If in 6 months, no pregnancy, come back.
Come back. Okay.
Fertility testing, imaging, whatever goes along with that. So that's another benefit of the preconception visit. In a woman who is less than age 35, we usually give them about 12 months to conceive spontaneously. Okay, a little bit longer. Reaching out and getting tested, because testing for infertility is pretty extensive on the female side. Blood work, imaging, maybe a special x-ray. Obviously, the partner needs a sperm analysis, but less than 35 a year, greater than 35 6 months before reaching help and evaluation of infertility.
Okay, that's great. And I didn't realize the process of like, okay, go see your OB again. I'm like, do you call a specialist? Do you go see, others? So that's great. Yeah, your OB can direct you in all of that. So wonderful. We did receive a question from an audience and I want to take time to answer. This one wants to know, what is the most important factor to consider when trying to conceive?
Oh my goodness.
That's kind of a loaded one, I guess. Is there one thing, or maybe there's a couple things?
Factors to consider. Number one, because I think pregnancy is an amazing thing, but if I've learned anything in this field, it's that you really need to be the healthiest you've ever been when you decide to carry a pregnancy. Because it's just, the analogy of growing something in the soil, right? Your body is the foundation for growing a pregnancy. So if you find that you're not healthy, whether it be medically, psychologically, in a relationship, forget about that too. If you are not total package healthy in all aspects, it doesn't have to be 100%, but if you really feel that this is not the time, then defer. Obviously, if you're getting to a specific age, and you're noticing that your periods are starting to become irregular because, you're starting to enter, a period of your time when your fertility is really going down, then there might be a little bit more pressure. But overall, rule of thumb, for me, really golden rule, be at your healthiest physically, mentally, emotionally, maybe even financially, especially now with COVID, how things are, okay, before deciding I'm ready to take that next step. Because if you treat your body well, if you treat yourself well, your pregnancy will be fine. It will be much easier for you to carry and much easier for you to deliver, and postpartum recovery as well.
That's good. That's good.
I with a broad.
No, that's great. That's good. You don't really have to think holistically like that. That it's, of course your body, but kids are forever and they're expensive. No, I'm teasing.
You know very well, pregnancy affects everything.
That's right.
Everything about us, our emotions, our body, our relationships, it affects everything. So if you're strong in all aspects, it's a much easier process to go through.
That's great. Dr. Franklyn, that's great. Okay, tell us, what does it mean to try to become pregnant? Like, I know a lot of people use TTC, like trying to conceive. Tell us more about that language.
Trying to be pregnant is not just, I'm not on birth control, I'm with a partner and we're having unprotected intercourse. You could get pregnant, you could, but when you're being evaluated for infertility, to say trying to get pregnant for those 6 or 12 months, what is
Right.
actually, and that's having timed intercourse in
Okay.
relation to your ovulation. So it's really intercourse every other day, 3 to 4 days prior to ovulation. And there are a lot of
Okay.
different ovulation calendars that are out there, especially with what we can find on our apps now. But it is making
Right.
sure that you have timed intercourse around the time that you possibly could release an egg, so that there's sperm in the area to give you
Right.
the best chances of conceiving
Okay.
naturally.
Okay. Yeah. Okay, great. What are some medical problems that might be important for like a woman to discuss with her OB prior to conceiving?
Right.
Maybe things that we don't think about of discussing.
Right. So, as I said, maternal health can affect a pregnancy's health and vice versa. So, when your OBGYN goes over your medical history with you, some of the things that are important to mention: a history of high blood pressure, any history of asthma, thyroid issue, whether it's hyperthyroidism or hypothyroidism, any seizure disorder, if you have any lupus or
Mm.
autoimmune disease, is one thing to really, really mention at this visit. Any clotting disorder, for example, you had a clot in your leg or a clot in your lung, it happened after surgery, it happened while you were on the birth control pill. That's very important to mention. A lot of patients forget that that is a medical condition, having a blood clot, whether it's in the leg or in the lung. Additionally, talking about previous pregnancy complications. I had a preterm delivery at 34 weeks, or I was walking around, I was about 21 weeks pregnant. I felt fine, no pain, and next thing I know, I delivered. It's very important,
Yeah.
and it changes what we do in terms of our management for your next pregnancy, like I talked about earlier. But definitely those are the main ones to talk about in terms of a woman's personal history, is her medical history and her past OB history.
Yeah, that's good. I always think when you're filling out all those forms and you get those long lists of like, no, 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 yes, no, 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 no. But it's so important to be able to discuss all that with your doctor. So really it's like,
Absolutely.
sometimes you stop and think like, yeah, what kind of things have I encountered that I may not be thinking could be, helpful for my OB to know. Are
Absolutely.
there certain genetic diseases that are important to share or to be screened for, I guess?
Yes, so definitely when you sit down with your OBGYN, you'll be going over genetic problems in your family and in your partner's family. Because remember, 50% of the DNA is from your partner. So anything heritable
Right.
can come from your partner's side of the family. So there are normal genetic screening tests that are done routinely during a woman's pregnancy, and that's to screen her for certain heritable conditions such as cystic fibrosis, spinal muscular atrophy, Fragile X is another one.
Okay.
There are certain other genetic conditions that are tested for based on a woman's ethnic background or religious background. For example, in the Ashkenazic Jewish population, testing for Tay-Sachs, Gaucher disease, and other heritable disease that come from that area is something
Right.
we could do also. And the main reason is to screen the mom. If anything pops up positive for her, then it's indicated to screen the father, because that will give us a better idea. What are the chances of passing this on to the pregnancy? Is it low or is it high? And if it's high, referral to the genetic specialist to go over what are the risks associated with the disease, so that the parents can then have more knowledge and more information to know what's going to happen if their child has a certain condition, so they're better prepared at the time of delivery and in the
Yeah.
subsequent years during the child's when the child's growing up.
That's good. So are these genetic screenings? Because I know when you're pregnant, you get offered the opportunity to have those screenings in your pregnancy. Can
Mhm.
some of these genetic screenings be done like in a preconception visit, or is
Absolutely.
it more so when you're pregnant?
100% done beforehand, because a woman's carrier status is not going to change whether she's pregnant or not.
Right.
So the preconception counseling visit is a perfect opportunity to screen the mom for certain genetic conditions, because then if she screens positive, then her partner can be tested, and if he's positive, well, then now they have the opportunity before they even become pregnant to know what are their risks, what are their options. And some of
Yeah.
these options include going to a specialist to be able to do genetic analysis on an embryo. That's something else too. So really, again, the core is to be able to give a woman and her partner as much information as possible to make the best decisions
Yeah.
for them and their family. So it's more proactive instead of reactive.
That's good. Okay. Is there anything we should bring with us, like to a preconception visit? What sort of things would we need to bring? And I want to know, is there going to be blood work? Or like, is that optional? I'm always like, I can deliver a baby, but don't give me a shot, please. No, I'm teasing.
Great questions. I will say for that, when you're pregnant, you are a pin cushion. It is no longer, I can't tell you, I mean, how many times did you get blood work done? And it's just because it is just a very, very monitored and controlled process to make sure that you are healthy. Again, we just want to make sure that moms are healthy, because the goal is to have a safe delivery and give you a healthy baby. So if it's a healthy mom, it will be a healthy baby. All right. So what to bring with you to your visit? I think it's always, always beneficial to bring your medications with you.
Okay. Yeah.
How many times, and I know this has happened to me sometimes, where when I was younger, I would forget the name of my medication, and you would say, oh, you know, it's the red pill, it's the blue pill, it's the white pill, the letter on this.
Like, how many milligrams was that? I don't know.
Have no idea. We could pull up, you know, pictures of pills online, but we're never going to know what you take unless you actually know it 100%. And a better way to do it is just bring your medications with you to your visit. It might be better to bring the bottle instead of just, you know, a handwritten note. Bring your medications so you can go through it with your doctor. There are certain medications that are not safe in pregnancy that are important to go over. There are certain medications where maybe the lowest dose is the best thing to take during pregnancy. There are certain medications that really should not be stopped and are bad in pregnancy. So maybe pregnancy is not a good time right now.
Right.
There are different avenues to kind of explore just by looking at your medications.
That's good. You don't really think about that, but especially if you're on a medication you've been taking for a long time, it's just kind of part of your daily rhythms that you can just kind of forget, like, oh, and I'm also, taking some XYZ or whatever. So that's good. That's good. I haven't even thought about that.
For example, there are some blood pressure medications that actually lead to malformation of kidneys of the pregnancy. So, you know, going over your medications with your OBGYN is an opportunity to say, this is not a safe medication. I would like for you to go back to your primary care or endocrinologist or whoever is taking care of that medication. I'd like you to go back, have them change it for profile. And most physicians are very well versed in what's safe in pregnancy or not, just because it's a very common thing when you're prescribing anything for young reproductive age women. But it's a really nice opportunity to change those medications before conceiving, before having to, again, being proactive instead of causing issues to the pregnancy just because you didn't go over your medications early.
Yeah. Yeah. Okay. That's good. And then the blood work thing you said at a preconception visit.
Blood work.
Tell me.
Blood. Oh my gosh. Pregnant women, you will be getting lots of blood work. And the reason is we like to screen you, not just for genetic conditions, but for infections. Yeah. We want to know everything. We want to make sure that there are no infections that could lead to fetal malformations. The infections that are usually prayed for are syphilis, HIV, gonorrhea, and chlamydia, toxoplasmosis, tuberculosis, depending on your area, depending on where you're from. Those might be drawn to cytomegalovirus in high-risk areas. These are all different viruses or bacteria that are going to be screened via blood work or with a cervical swab on a pelvic exam that your OBGYN will definitely want to check in order to treat you early and to prevent any issues once you conceive.
Okay. All right. You rattled off a list of things, and I'd heard of most of those. Except a couple, and one stuck out to me, which was the toxoplasmosis. And I've heard that there's like some link to cats. Tell me more. I know nothing about this.
Yes. So toxoplasmosis, it's a parasite that is usually found in raw meat. Cats eat raw meat. So oftentimes cats are infected and it's in their feces. So
that's not listeria. It's not the same thing.
It's not the same thing. Listeria is another bacteria that's in unpasteurized milk products, which is another thing to avoid. And we'll touch on that in just a little bit, I'm sure. But for toxoplasmosis, that's why there's that correlate between that parasite and cat feces. Now, does that mean you have to get rid of your cat? No, we will not part you from
all the cats. Go away.
No, you're
I'm
absolutely.
not a cat person, so I'm like, send the cats away. No, I'm teasing. Those who have cats are like,
I have
please, can
a
I
puppy,
keep
but
the
I
cat?
love cats. I love cats. I think they're wonderful and they're very much a part of the family. You do not need to be separate from them
They
if
can
you're pregnant or if you're trying to get pregnant. But there are certain
stay.
things that you can be doing differently when you're pregnant. For example, if you are going to be changing the litter, firstly, if you have
Mhm.
someone to help you, that'd be great to say, excuse me, can you go clean the litter for me? I mean, what a
That's
great
a good chore to pass off.
yeah, what a great chore to pass on. Sorry, you could say that, but also if you're alone, it's absolutely okay to do it yourself. Just wear gloves and wash your hands with warm soapy water afterwards. Additionally, because it
That's
is
good.
found in raw meat, do not eat raw meat. Skip the tartar and go for something cooked.
Yeah.
Always wash your hands if you're handling raw meat before cooking. Wash the countertops. Wash raw vegetables. Just be very hygienic about what you're eating. Always washing your hands in between cooking and then ingesting food, especially if you're eating with your hands.
Okay, that's good. I got learned something new. I didn't even know that. Okay, I have a question from the audience about maybe like a pre-existing condition sort of question, but what kind of questions should a woman ask her doctor if she has PCOS with no symptoms, but she had a surprise miracle baby and she's thinking about having another baby in the future? So I think one of her things that she's bringing with her is this PCOS, but no symptoms.
So that's
What would you
definitely
advise?
bring up your gynecologic history. If you've had a history of abnormal periods or already a diagnosis of PCOS, polycystic ovarian syndrome, then we know that there is already difficulty with ovulation. So this might actually be a patient that I wouldn't wait too long to see if she conceived naturally, just because the chances are very low. And especially if time is of the essence, such as advanced maternal age, I don't want her to be trying for months and months. There are certain medications that OBGYNs can give to induce ovulation in order to
Hmm.
increase the chances of pregnancy. But always before doing this, I need to make sure that whatever patient with PCOS, if weight is an issue, to address weight first before conceiving, because that might be what's holding her back. Absolutely.
Great. And that's helpful.
Mhm.
Okay, back to preconception visits. We asked about blood work, but what about injections? Like, is that something that is part of a preconception visit?
Yes, yes. Injections in the form of vaccinations.
Okay.
At
Okay.
this visit, your OB will also address your whole vaccination status at this visit. Some of the vaccinations that are really important to go over include MMR, measles, mumps, and rubella, which most of us who are born here in the United States are vaccinated against. But obviously, here in Miami, I see a lot of unvaccinated women.
Oh,
The flu vaccine, human papilloma vaccine to
mhm.
prevent against cervical cancer and genital warts, varicella or chicken pox. There's the Tdap vaccine, which stands for tetanus, diphtheria, and pertussis being whooping cough in babies. And then, of course, hepatitis B, which a lot of us get when we're newborns. But again, for women, especially coming from outside the country, some of these are not standardized vaccinations, and it's really important to address at the preconception visit. The
Okay,
reason
that's good.
why it's important to vaccinate or be vaccinated is because a lot of these infections,
Yeah.
the pertussis, varicella, chickenpox, the flu, they can really cause issues in the mom when she's pregnant or can lead to congenital infections if they're not treated.
Okay, wow. We did an actual one of these parental guidance series on COVID and flu. And one of the things that we talked about, the doctor was speaking about the flu vaccine and how those antibodies are passed down to the baby. That takes about a couple weeks for everything to transfer and move. And then, of course, if you're nursing and whatnot. Um, so I went and got my flu shot in the meantime since we had that conversation. But yeah, and then the Tdap, even, you're talking about that. Are there benefits to having these things with every pregnancy, or are there certain ones like one and done?
Yes, so every pregnancy, just like you said, when a woman who's pregnant gets vaccinated during the pregnancy for the flu or gets the Tdap to protect against whooping cough, the pertussis component, which is usually administered between 28 to 36 weeks. Every
Mhm.
pregnancy, when a woman is vaccinated, she builds antibodies that go passively across the placenta to her pregnancy. So when the baby is born, the baby actually has a natural immunity. Babies usually can't get flu vaccines until 6 months of life. And for the
Right.
which they can be infected with in those next few months, especially if there are other kids in the house, especially if there are pets in the house. It's very, very important how beneficial that a newborn can be actually already passively vaccinated against those two.
That's good. What about our family? Like, your spouse or your partner, family members that are going to be around. Like, do they need all the vaccines to promote health for future pregnancies
So
and newborns?
just as a pregnancy can kind of motivate a woman to take care of herself when she may not have in the past, a pregnancy can actually motivate family members to take the initiative to be healthy also in order to protect the pregnant woman and her newborn when she delivers. The flu vaccine, absolutely. They all need to be vaccinated in order to decrease passage to the pregnant mom. You know, pregnant moms, they already have such a heightened awareness of their health. They care about where they go, who they talk to, but not everyone else who's not pregnant. We go out, the supermarket, we go here, we go there. We really don't think about who we come in contact with and bringing it home to the mom. We're doing that now with COVID, but we also should be doing
Right.
it with the flu equally. So it's very, very beneficial for family members or people that a pregnant woman is surrounded by to get the flu vaccine so that they don't pass it to the pregnant mom. And we know without a doubt that flu in pregnancy, flu in you is going to be very different from the flu in me. Pregnant women, when they're infected with
Right.
much higher risk of having respiratory distress syndrome, needing intubation, being hospitalized. A flu for me, I'm going to be in bed, maybe take some Tylenol, I'll feel better, some chicken soup, and I'll be great. But flu in a mom is a completely
That's
different thing. So to vaccinate other family members, very important. And then for the Tdap as well, for them to be vaccinated against pertussis, even though the baby's already immunized, how much better to help protect if everyone else is vaccinated.
That's good. Yeah, let's just create a little protection bubble around us as we can. That's so good.
Take care of your
I,
very special populations, moms and babies, of course.
yeah. Yeah. Oh, I love that. This is so good. I'm so enjoying this, Dr. Franklyn. I feel like we're just having like a girls' night out chat. I'm sure maybe there's some gentlemen out there listening as well. But those of you who are watching, I hope you're enjoying this. If you have any particular questions, please drop them in the Q&A. But we're going to keep going. I've got some more for you. And I'm watching the clock. We're going to keep it right around, an hour. So, but okay, what about prenatal vitamins? When should I start?
Yes.
If I'm thinking about conception, and then also how long after, like I'm planning to nurse. So should I continue to take prenatal vitamins after the baby's born?
Excellent question. So usually we recommend starting a prenatal vitamin 3 months prior to conceiving. And that's just to make sure that a mom's nutrient status, other than her overall health, but nutrient wise is where it needs to be prior to conceiving. So 3 months is what we recommend, but definitely if you're trying to become pregnant, and remember trying is having timed intercourse every other day, 3 to 4 days before ovulation. Once you're trying, start a prenatal vitamin so that you're not behind in your nutrients. And then afterwards, if you're breastfeeding, just continue it every day. Your breast milk has a lot of nutrients that are leaving your body, so it's really good to replenish it with a prenatal vitamin.
That's good. So would you say as long as you're nursing, just continue to take the vitamins? Yeah. Okay, that's good. What about I always hear about folic acid, and is it sufficient? How much? What level of folic acid is enough in a prenatal vitamin?
Yes. So, I guess just to review, folic acid is a very, very important component of a prenatal vitamin because it prevents neural tube defects. The neural tube in development of a pregnancy makes the spine, makes it nice and closed, as well as the front part of the belly closes the belly. What we do know is that the neural tube closes between 24 to 26 weeks. Now that's very, very early in a pregnancy. So you can imagine a lot of women don't know they're pregnant at that time and they haven't been taking a prenatal vitamin. So that's why it's so important to start a prenatal vitamin before even getting pregnant, because more often than not, it's too late to get those benefits of the folic acid. So when you're looking at a prenatal vitamin, honestly, go with whatever works with your budget. There are so many of them. There are some in our pharmacy. You can go online. My God, I don't even want to think about what's on social media to sell prenatal vitamins, but just find one that has a folic acid level of 400 micrograms. That's really what's needed in order to promote closure of that neural tube. Now, there are certain conditions where that folic acid level is not enough and a woman needs more. In a woman who has a seizure disorder and is on anti-seizure medications, for example, or a woman has a history of a child with a neural tube defect like spina bifida or gastroschisis or omphalocele. These are big words, but moms will know what I'm talking about if you've had a child with this malformation. You really need to have extra supplementation with folic acid, and we usually bump it up to 4 milligrams daily from the 400 micrograms. Okay. I see a question here. Is taking folate better than folic acid? Okay, that's actually a very, very good question. There are certain conditions in certain moms called MTHFR, where it's a mutation that we don't always test for. We really don't. We don't test for that unless there's a genetic issue in the family, unless there's, a lot of clotting disorders in the family, where it makes it very difficult to activate the folic acid. In that case, we promote taking folates. I really can't say yes or no what you should be doing in that respect. I think if you're healthy with no medical problems and no history of clots, folic acid is perfectly fine. If you have a history of clotting or clotting disorder in the family, or you have been tested before for an unknown reason, then I do recommend taking the folate. And there are a lot of prenatal vitamins out on the market now that you can find that have that change in the folic acid.
Okay. That's helpful. Great question. I love it. Yeah, if you guys have any other questions, keep them coming. Okay, so what about in addition, to a prenatal vitamin, what else should we be doing to make sure that our nutrient levels are supportive of a healthy pregnancy?
Keep it simple, healthy diet. Healthy diet. Huge emphasis on fruits and veggies. Our diet nowadays could solve so many issues that we have going on. High blood pressure, diabetes, all those things, if we just had a healthy diet. And unfortunately, I know now with COVID, Uber Eats is such an easy thing, but we have no idea what's going in our food. I know it's tasty, but you don't want to know how much butter, you want to know how much stuff they put in that food, and I really think in this time especially, it's been really nice. I know myself included and some of my friends were cooking a lot more, so we know what's going in our food now, which is really nice. But definitely a healthy, well-balanced diet. Fruits, veggies, lean meats, good, fatty acids such as with salmon, avocado, those are all really good things. Less carbs, less salt, less sugar, all the bad stuff. So really, really a healthy diet.
Yeah,
and
that's good. That was
not just healthy diet, but in conjunction with exercise. Diet and exercise is always better than diet alone or exercise alone, always. So we usually recommend about 30 minutes of moderate exercise so that you feel that you're really getting your heart up and racing a little bit for 4 days a week. Usually a nice brisk walk is good. If you're a runner, continue running. If you like to do certain, classes, do classes. I don't recommend doing anything that could increase your risk of any abdominal trauma, such as with kickboxing or free weights or anything like that. Keep it nice and safe. But if you're an active person, keep being active. If you're not, now's a nice time to go ahead and start being a healthier version of you.
That's good. That was my next question. I was like, certain foods or drinks, and you said sugar and alcohol to avoid, but also like over-the-counter medications. Like, are there certain things we should avoid?
Good question. Great question. So definitely avoiding all alcohol and nicotine. It's been shown to cause some fetal malformations, and there is no known safe level that we've been able to find yet of either substance. So we just say, listen, just stop any alcohol, any nicotine to promote the healthiest pregnancy as possible. Now, in terms of over-the-counter medications, there are certain medications that are contraindicated in pregnancy, typically the NSAIDs. So anything like ibuprofen, Motrin, Aleve, naproxen, anything you take for inflammation and pain, you should really switch over to Tylenol. Tylenol is very safe in pregnancy. Additionally, if you have any sinus or cold, staying away from medications with phenylephrine or pseudoephedrine in the medication. So Robitussin is usually a better alternative than those other medications. Not only with the alcohol that we were talking about, nicotine, but certain foods should be avoided that I'd like to touch on also. So
Please.
the foods that we should avoid in pregnancy, we already talked about raw meat. Always
Right.
have meat. Don't eat raw fish. If you're going for sushi night with the girls, just go for, I don't know, a cooked piece of salmon. You'll get to the sushi later, I promise. A small sacrifice for the pregnancy. But there are also certain milk products, unpasteurized milk, to increase your risk for listeria. So you want to make sure that all of your dairy products, milk and cheese, are pasteurized only. I usually want you to stay away from processed meat like hot dog and lunch meats. Those are really one of the major things to stay away from. But it leaves you a lot of other alternatives to eat, and healthy alternatives. Healthy fruits and vegetables.
The good stuff. The good stuff. Don't travel to Italy or France to eat fancy cheeses and drink wine during pregnancy. It just won't be good for you.
Be difficult to go over for many reasons other than that.
That's right. That's right. Yes, especially right now. Okay, let's talk about weight and how that is a factor with pregnancy. Someone who may be overweight and wants to lose some weight prior to conceiving, to have the best outcome for their pregnancy, how much weight do they determine to lose? Like, how much do they need to lose?
So that is a wonderful question. It's really an issue at the forefront of the field of obstetrics and gynecology is obesity. We just know it's an epidemic. It's happening more and more in younger and younger ages. And before, the field of OBGYN used to be pretty kind of protected against obesity because younger moms weren't really that obese, back then. But now
Right.
with the advance of, easy eating, fast food, a more sedentary lifestyle, a lot of us sit at our desk when we're meant to be up and moving for the majority part of the day. We're finding that a lot of our young moms, even teen moms, are now obese, and it's a huge problem. Obesity, with pregnancy, it can lead to a lot of issues. Number one, recurrent miscarriages. It can lead to pregnancy complications such as high blood pressure and diabetes during the pregnancy, and even during the labor process. It can lead to abnormal labor, the inability of the baby to descend, pushing forever, and increasing risk of need for C-section because these girls just can't deliver their babies naturally because of the excessive weight gain. The obesity is already pre-existing. So the rule of thumb, you want to get as close to a normal BMI, which stands for body mass index, as possible.
Right.
A normal BMI is 18.5 to about 25. Obesity is considered a BMI of greater than 30 or higher. So in order to calculate, can't really remember there's online, you can just put in your height and your weight.
Google it, ladies. We can Google this. Everyone right now is thinking, let me go Google that real fast.
It's really important. Google your height and weight BMI calculator to find out what it is. Try to get as close to a normal BMI, less than 25, greater than 18.5, in order to, number one, again, make yourself the healthiest before putting yourself through a very stressful process, which is pregnancy. It is very stressful. It's very taxing on the body. So how much easier would you be able to handle it if you already at an easier weight to manage? And conversely, not only overweight patients, underweight patients, don't forget about that. Young girls or older women who are under a BMI of 18.5, who have eating disorders, for example, anorexia nervosa, bulimia, or who over-exercise and just don't want to put on any weight or can't put on weight, they also have issues with their pregnancy, leading to growth restriction in their pregnancy. So to be in that nice, healthy weight range is probably ideal.
It's good. Thank you. Okay, I have several questions from our audience that I want to get to. Circling back to the foods that we talked about avoiding, the lunch meats and processed meats and whatnot. Does heating up deli meats kill listeria? Like, I know I shouldn't have a turkey sandwich, but can I have a turkey melt? Does heating it up, or do you just say avoid it altogether?
So cooked meats, so those oven roasted turkey slices, it was already oven roasted. That's a different story. I'm talking about those like sliced deli ham, sliced bologna that was just kind of packaged.
Okay.
If you were to cook it, I think you'd kill most of the bacteria. But again, just like antibacterial, 99.9%, I can't guarantee you anything. So just
That's right.
Leave the lunch meat. You don't want to have lunch meat anyway.
That's right. Go make yourself a salad, ladies. No, I'm kidding. I get it. Sometimes why is it that you just, I mean, it's the nature of our hearts, I think, that we crave the things we can't have when, when we shouldn't have them.
So I think the art of pregnancy is just finding that really good for you food that you crave. And so when you eat a lot of it, when you wake up the next morning, you're like, no problem. I ate a bunch. It was good for me. I'm going to go on with my day. That's the secret, I guess. I don't know.
That's right. That's good. All right. One of our attendees wants to know, what are your thoughts about iodine supplement and organic foods?
Organic foods are great. I love them. I do know that they're more expensive than regular foods, and regular vegetables, regular, fruits are fine as well. Iodine. The thing is, here in the United States, so much of our food is fortified in iodine that really, if we have a well-balanced diet, we should not be deficient in it. And even in women who have absorption issues like gastric bypass or ulcerative colitis, we even don't really check the iodine status in their nutrients profile, which is something that I frequently check on every trimester, like folate or B12. Iodine is just not one of those things that we really need to supplement because it's so fortified, especially in our salt. We shouldn't have as much salt, but it's definitely in the salt that we have here in the United States. So it's not something we really have to worry about.
Yeah. Okay, good. All right. A couple questions about COVID. So let's go there. We've got a few minutes left. What is like the latest research about COVID-19 and pregnancy? Like, how could pandemic affect pregnancy? How could COVID, what does it do to us in pregnancy? Tell us everything you know.
Obviously, I mean, it's gonna be a lot of it from research and a lot of it from, personal experience. This past year with the pandemic has been a huge change for us as OBGYNs, physicians as a whole, and definitely our patients. From all of the research that we've been able to do, and mind you, this is what medicine is all about. It's obtaining research from patients, trying to do our best, and in the meantime, gathering research so that 2 years down the line, 4 years down the line, we have concrete evidence to be able to give more information. So I have to say as a disclaimer that research is still being conducted. We don't know enough. I'd say we don't really know anything. We really don't. But what we have been able to find so far is that pregnant women do not have an increased risk of getting COVID. Yes, they are an immunosuppressed population, but overall, pregnant women are healthy. They're really healthy and they take care of themselves. So that's already something to be said. But we also do know that if a pregnant woman does contract COVID, just like with the flu, she's at much higher risk of being hospitalized, having respiratory distress, and needing intubation. And that's why it's very, very important. Always wash your hands, maintain, your social distance from people that you really don't know. Make sure people around you are practicing the same things like we talked about earlier. Just because they're healthy here in the house, just make sure they're doing the same, because whatever they do outside, they bring inside to your home. But that's how we know about about COVID in pregnancy. We have not found it to be positive in the breast milk. That's why we still condone breastfeeding, even in COVID positive moms. We still condone skin to skin, which has huge benefits for the newborn. But these are all things that we're just trying to find out little by little as best as we can. Now, in terms of the overall pregnancy experience, it has definitely changed the face of prenatal care and delivery. For example, I'll just give from my office, and it's very similar in other offices. Before, when partners and family members used to come with pregnant women to their visits, now it's really a more solo visit. Partners really don't come anymore. They're not there to kind of share in those moments. It's really a pregnant woman forging her own way through this, with the guidance of her OBGYN, which is it's a nice personal, intimate relationship, but it's not the same, obviously, as having a partner. And it's a very common occurrence for me to meet the partner finally in the hospital at the time of delivery.
Yeah, right.
That's the difference.
Wow, yeah.
It's very different. And then, in the hospital too, what used to be a very social area, the labor floor and also postpartum, now most hospitals allow one support person to be with you in the room at the time of delivery, and that same person for your postpartum stay and to be discharged as soon as possible. So the hospital, instead of being more of a social area, it's now a place to deliver, have a good outcome, recognize any issues, and then to go home safely. And that's really it.
Right, right. That's good. Thank you. Oh, wow. Dr. Franklyn, this has been wonderful. I do want two blitz questions and then we'll wrap up our time here because I see that we're running out of time, but I think we can keep going for a while because we are very interested in this topic and you have just been super thorough and we appreciate that so much. So one mom wants to know any book recommendations for preconception and or pregnancy like that you love to recommend.
Any what? I'm sorry?
A book recommendation?
Oh, a book. Oh my goodness. Can I just tell you, I can't condone any books because I think everyone's journey is so different. I think the most important thing is finding a good OBGYN, being open and honest in your visits, and then find the best that works for you. If you have issues, bring it up to your OBGYN or pull from knowledge of other women in your circle, other women who've gone through similar things. Every woman has a different delivery story, they do, but they're a wealth of knowledge when it comes to back pain, round ligament pain. What did you do for this issue with swelling? All these things that, yes, you can find in a book, but there's such a large amount of them out there, and I'm sure they all give amazing, valid information, but I can't condone one or the other. I just really very much condone an open, honest, good, strong relationship between an OB and her patient, and then with the patient and her social group.
Oh, that's so great. Thank you. Yes, to have that openness with your doctor. You should be able to talk to your doctor. If you don't feel like you can talk to your doctor, you might need a new doctor.
Yes.
Um,
My God, it's the
yes.
most relationship kind of the partner and the patient. My God, of course.
I know. I'm like, everyone here tonight needs to go look up Dr. Franklyn because I'm like, I could talk to you about anything. This is easy. There was one question I saw that was floating in the chat. It says, any special recommendation for preconception after open myomectomy? I don't know.
Okay, so the open myomectomy is removal of a fibroid.
Okay.
Fibroid are benign growths that happen in the uterus. A lot of women have them. They're very common. They're non-cancerous, but they can cause issues such as pelvic pain and heavy periods and painful periods. So one of the ways we treat them is by doing a surgery with an incision on the belly to remove them. So that's a great question. Any woman who's had an open myomectomy, a removal of a fibroid with an incision, really, again, the interval between the pregnancy should be at least a year in order for the uterus to heal. And something that needs to really be stressed and something that hopefully the gynecologist who performed the surgery let her be aware of is that when she delivers, it will be via C-section when she reaches full term at 37 weeks.
Okay. Okay. Wow, good stuff so much. Like I said, I came in going, preconception care. I don't know. I mean, you just show up when you're pregnant, right? But this was so helpful. I'm really thankful, Dr. Franklyn. I appreciate your time so much. Everyone who listened in, I hope you enjoyed it tonight. I wish we could get to every single question because there's so many. We could keep going all night. I do want to take a minute and just tell you all a little bit about Jackson Children's Care, UHealth Jackson Children's Care. So there are pediatric emergency rooms at Jackson North and also at Holtz Children's Hospital are available 24/7. So a lot of people don't know that. And the Holtz Children's is actually a 24-hour kids only emergency room. So if in this season of COVID, heaven forbid something happens to your child, you're nervous about taking them to a huge ER, take them to Holtz because it's 24 hours, kids only, and you're going to get the access to every pediatric subspecialist within the system of but also of Holtz Children and the Jackson Health System. So you're going to get quality care, everything you need. All the staff are board certified pediatric emergency medicine specialists, as well as the doctors and nurses at Holtz. They're certified in pediatric advanced life support. So if you're a mama and you've got little people and something happens, we just want to remind you these things, that there's amazing resources there and available for you. So, and if you didn't get to listen to last month's webinar. It was all about flu, and actually a mom who had a crazy emergency with her child who had flu, and it just got real inflamed and bad. She talks through just her whole experience of their stay with Jackson. And so I just commend that mama, and I encourage all of you to go back and watch that one. You can watch it on jacksonevents.org. All of the previous webinars are there. But go ahead and mark your calendars, because December is wild. We all know it gets crazy busy, but you want to join us on Thursday, December 3rd. So it's going to be our last parental guidance episode of 2020. But even those of you in Minneapolis and Houston, you're welcome to join us again. The holidays are a time to gather, to be with family, but obviously with COVID in play, it can be challenging. And so we're going to have experts. Dr. Brandon Chitani is actually infectious diseases expert. So he's going to be with us, as well as Dr. Audrey Ophir. And so they're going to talk to us about how we can have a safe holiday season in the midst of COVID. So Nate plans to join us for that Thursday, December 3rd. And then I also want to tell you, if you have children, and if you don't, and you just love Christmas and Santa, we are super excited. Miami Mom Collective is partnering with Jackson Health again on Saturday, December 5th, for our 3rd annual Cookies with Santa event. So it's going to be virtual this year, so you can join from your home, but we're going to have a live chat with Santa, caroling, games, giveaways, the whole shebang. It's going to be a lot of fun, a family event. So you can learn more at miamimomcollective.com. Our tickets go on sale tomorrow. So we're thrilled to be partnering with Jackson to bring some holiday cheer, because we all need a little bit more of that this year, right? It's been a crazy year, but we're going to finish it strong. So just thank you again for joining us tonight. Dr. Franklyn, thank you so much. You'll see right here are some great resources for you to follow up and have just more information on the topics that we spoke about tonight. Super important topic. Dr. Franklyn, thank you so much for bringing your wisdom. We're so grateful.
No, I loved it. Thank you so much for having me.
Of course. And please, guests, we hope that you will join us again on Thursday, December 3rd, for our next final episode of the year in the Parental Guidance series. So again, thank you so much. And if we can be a resource for you at Miami Mom Collective, as Dr. Franklyn was saying, just connecting with other moms and talking through experiences, helping you find and connect with an OB that you can talk to. We are here for you to do that. So, and thank you again just for UHealth Jackson Children's Care for hosting this series and getting these resources into our hands. So I hope everyone has a wonderful night, and we'll see you December 3rd. Take care. Good evening, everyone. Have